So we're going to talk a little about myStrength when we get the PowerPoint up, hoping to also show you a little demonstration, have a little video to include as well. Just myself, I've been in the public mental health world since 1991, managing outpatient day treatment programs, working with a lot of seriously mentally ill folks. I've been with myStrength for the last 3.5 years, and the co-founders of myStrength, am I not doing this right, Robert? There I go. Unfortunately, Scott's photo did not show up on this particular slide, but the two co-founders of the company were a 6-year-old company out of Colorado. Scott and Matt are both out of the tech world, but they experienced mental illness in a real direct way, which really launched their initiative to develop myStrength. Developing a really strong leadership team, big, strong clinical focus. You may recognize some of those folks on our clinical board. Investor and partners, the Colorado Health Foundation, the third largest, I think, health foundation in the country, invested $1.5 million into myStrength a few years ago. We've developed just some wonderful relationships around the country, the National Council for Behavioral Health. So we have an exclusive relationship, strategic relationship with them. What is myStrength? Online self-help tools. So we really want to be able to provide something that's engaging to clients, empowering clients to be more participatory in their care, and something that has, condition-specific programming, but also something that's very holistic in its approach. So when you talk about community inspirations, when you talk about mind, body, spirit, all of it is incorporated within myStrength. And our mission is real simple. We just want to create, and we have, and we continue for it to evolve, but a really engaging, effective behavioral health platform. And again, it's all about empowerment. We've been talking about empowering clients for a long time, making them, again, part of the care plan. And so having the technology at hand, and our model is incorporating this and partnering with payers and providers. So how do you get these tools into clients' hands? It's through the payers and the providers, and having them making it part of one's treatment plan and really engaging folks with these types of tools, and I'll get into that in a moment. We all know the problem that we're facing. I think Karen articulated that really well. We also understand that the current system just is not ready to take it on in its full capacity. One of the saddest things is we know we're losing 78 folks a day to this epidemic. Karen, I think you said there was 214 people in Pennsylvania this year. That was just, okay. Well, anyway, so on a personal level, I have two folks that I know of, friends have children lost in this year to this epidemic. So something that we are very passionate about as a company, and something that we want to really try to help make a difference. The interesting thing, and one of the complex things about pain, is the comorbidity. So many times this gets unaddressed. So 60% of folks that are suffering with pain, they also have depression and anxiety. And if we're not really, we feel if you're not really incorporating a treatment where you're looking at the depression, you're looking at the anxiety, looking at the pain, and really looking at the whole person, we may not be doing what's best for that particular patient. With myStrength, we really look to integrate the tool within, again, a care model. Not replacing pharma, not replacing face-to-face, but again, really softening the edges and really incorporating this into one's organization. If we have any clinicians in the crowd tonight, you may recognize these workbooks. So we have an exclusive content relationship with this publisher. New Harbinger is the largest publisher, the most dominant publisher for evidence-based self-help workbooks. So 6 years ago when myStrength started with depression and anxiety just broadly defined, 2 years ago we rolled out our substance use disorder program. We just 2 weeks ago launched our chronic pain program. So really exciting stuff, and really, leveraging this relationship and taking, again, these evidence-based self-help workbooks and digitizing them and making them part of the experience. Here's a quick snapshot of the folks that we work with around the country. So we have over 100 community mental health providers, health systems, ACOs that are using myStrength. We have around 75,000 registered users with myStrength. So we're collecting a lot of data. We just hired a data scientist. We just brought on a VP of health economics and outcomes to really dig deeper, and making a difference, because that's what this is all about. So And these are all the safety net providers. So in Pennsylvania, you may recognize a few of these folks. But again, safety net providers working with folks that have, depression, anxiety, dealing with the chronic pain. And the reason that we developed our chronic pain program, over a year ago, our providers were asking for it. So our program has been in process of development for over a year. So this isn't something that we just developed yesterday. So we also have we've been adopted by some of the major health plans around the country, as well as health systems and consumer platforms. So, it's all, we talk about, the triple aim. So that's really what we're doing. We're addressing the triple aim and really, again, wanting to help folks get better and help folks stay better. I'm going to show a 2-minute video right now, but the way that we developed our chronic pain program, actually it's like 3, I think of it like as a pyramid. 1 is taking a look at all the research. What is the best of the best out there, and how should we be incorporating that? Number 2 is let's get the docs, let's get the clinicians that are dealing with this on a day-to-day basis to help build the program. Number 3, and I don't want to say most importantly, but it probably is, it's the patients. So there's the faces of the chronic pain. That's that's a big part of the content of our program, is kind of that peer, because it's so interesting to hear what the patients say about what they're facing. There's a lot of mistrust. There's just a lot of uncertainty with them of what to do and how to do it. So I tell you what, let's watch this video.
The pain never stops.
It feels like you're on fire.
It's unbearable.
It's always there.
My body is hurting so bad.
Full body pain from the neck to the toes.
They were so quick to give me morphine, Oxycontin, Demerol. I was taking like all these pills like M&Ms. I'm really grateful I'm still alive, because I shouldn't be.
I know that doctors put many people, many diseases, many pain issues into one box.
There's a spiritual part and there's a humanity part. It's not just physical.
That happy dance.
I don't want to feel like dead in the inside, or, alive. You want to be alive. I want to be alive, so basically that's how I want to feel.
So that's the video. And again, so these are like the faces of chronic pain. And if I'm a patient, I'm listening to them. We talk about in the SMI world in particular, peer-led groups and peer-to-peer, things like that. Same in the world with chronic pain. Getting with a peer to understand that and just make it part of the treatment. Make it incorporate that and take, these kinds of technologies, the VentCat that Dave were talking about, and find ways to incorporate them into what you're doing, because obviously we hope that they can help kind of get us to that next stage. Robert, do I have time just to bring up the platform real quick? Can you help me kind of navigate there? So I'm just going to show you the platform that we've developed. Very simple. In fact, I think it was VentCat that mentioned it's got to be easy, it's got to be simple, it's got to be intuitive. This is the next iteration of myStrength. So again, making it really easy for people to navigate. Do I have any Netflix users in the audience? Or people that Xfinity? Or oh, it knocked me out. So give me one moment. And the reason I say that is because you're going to, oops, sorry about that. Oh, there I am. Let's see if that gets me in. So I'm going to show you just something really, really quick here. So if you're familiar with Netflix or any of the other things, and really being able to build out what we call channels of activity, taking these programs in particular and really giving clients the opportunity, what do I want to work on? So again, that's more than 60% of folks dealing with pain, dealing with depression. So maybe I want to go into our evidence-based depression program, or I want to go into our chronic pain program. But when we talk about taking a holistic approach, we really mean it. So when we talk about mind, body, spirit, and we want to be able to provide these other wellness resources to folks, we want to provide spirituality resources to folks. So we have over 75,000 users with myStrength. 85% continue to tell us spirituality is important in their recovery. So really interesting. I think you actually heard one of the patients in chronic pain talking about that as well. So all of these pieces become part of the puzzle. And what we've done is we've actually put a learning engine behind the scenes of myStrength. So there's a learning algorithm that will continue to understand what you like and what you want, and we will continue offering up more of those tools to you. My time is up, and I do want to respect that, and I really appreciate you guys listening and giving us a few minutes. So thank you.